So here we have a patient who's come to us with a complaint of facial asymmetry. So if you notice this, that he has quite a gross facial asymmetry.
Issues, he's not able to open his mouth enough. Number one main issue. Secondly, he's got issues with the shape of his face. So if you draw a midline, you can see there's not symmetry. So he has facial asymmetry, facial deformity. Plus, if you see the proportion, this side is really short, protruded, and also you can see there's no jawline. So we're going to take care of both his functional and aesthetic concerns in one go. We've got some gauze inside with some medication because we're going to be doing blind nasal intubation for him, and this is going to take us about 5 hours.
Where his right side of the face is deviated to the left and there is retruded chin. Ek baar turn kariye please. So if you see from here, the profile is convex, straight, where the lower jaw is retruded. So if I ask him to open the mouth, can you please open the mouth for me? Okay. So if you see that there is reduced mouth opening and there is deviation of the lower jaw, the mandible, towards the left. Close kariye. Open. Open. So he's putting increased effort in opening the mouth. So this is a condition called as left TM joint ankylosis. So the joints that we have over here are called temporomandibular joints or TM joints. So he has fusion of this joint, and because of the fusion of this joint, he is not able to open the mouth. So today we have planned a excision of this ankylotic mass, so the fused mass, and then replace it with a custom patient-specific implant or a temporomandibular joint prosthesis, similar to the knee joint prosthesis. So this is a big surgery that's planned under general anesthesia, and we are taking him up right now.
So what you're seeing here is the planning for a patient on whom we've done orthognathic surgery along with temporomandibular joint reconstruction. So this is a patient with severe facial deformity before and now after. You can see how much of improvement we've done to his entire face, both in the lower jaw, upper jaw. So we've also done a joint replacement, and you can see the on-table results. Remember, this is not just a cosmetic case because he couldn't open his mouth, so we've done work on the left side. I want to show that because we have yet to suture up there.
Just done with a very long case, maybe 6.5 hours. The case of left-sided TMJ ankylosis, we have done left-sided TMJ reconstruction, that is temporal joint plus release and reconstruction. The surgery went long as we planned. So 1 more hour left, so patient is doing well. Thank you.
मेरा पहला ही सर्जरी है ये। मेरे को मुंह खोलने में तकलीफ होता था और मतलब तो फेस भी टेढ़ा था, तो अभी फेस तो ठीक लग रहा है और माउथ भी ज़्यादा खुलता है। अभी फ़िलहाल तो नई नई सर्जरी है तो थोड़ा इधर तकलीफ होता है, लेकिन मतलब हो जाएगा ठीक।